Hello, Yuri. My name is Marina, and I'm a nurse practitioner student at the University of Cincinnati, and I would like to perform a HEENT examination of your head, ears, eyes, and throat or neck. Would that be okay with you?
Yes.
Okay. I'm going to explain everything as I go, but if you have any questions, you can stop me and ask me anytime.
Okay.
Okay. First, we're going to start with the visual head examination. Just look for any visual lesions, hair distribution, any rashes, discolorations, asymmetries, any scarring, recent trauma, and stuff like that. And then we proceed to the inspection. I'm going to palpate the scalp of the head, feel for any lumps, bumps, indentations, scarring, any lesions that I can visualize while going through the scalp. Okay. Also, I'm going to palpate the sinuses. Let me know if it's painful at any point. Okay, that's good. Now to check the temporal arteries. Okay, and no bruise here. And I'm also going to auscultate for bruise there. All right, thank you. Next, we're going to move to eye examination. And first, I'm going to look at, just visually inspect the eyes for symmetry, color, hair of the eyes and brows, any crusting or discharge from the eyes. Next, we're going to check the eye acuity. I'm going to use the Snellen handheld chart. So I'm going to stand 6 feet away from the patient's eyes and ask you to read, can you read the smallest line here?
G, E, F, P, O, G, E, C.
Okay, thank you. Now close one eye with your hand and read the same line.
G, E, F, P, O, G, E, C.
Okay, and the opposite now?
Yeah. Upper one?
Opposite.
Okay. G, E, F, P, O, G, E, C.
Okay, very good. 20/20 vision. So the next, I'm just going to visually inspect your eyes and also palpate and look into the inside the eyes, sclera, and any discolorations. Then I'm going to look at the with the light and inspect the external eye as well. So please look straight ahead. Try to keep your eyes open. So I'm checking the reflection of the light, also pupil reactivity to the light, and also with the oblique lighting, if there is any foreign bodies or discolorations, uneven discolorations of the eye. Okay, the next one is going to be the exam of the internal eye with the ophthalmoscope. And so I'm going to go ahead and turn the light on. Sorry. And using the right hand and my right eye, inspect patient's right eye. Look straight ahead there, please. Try to keep your eye open. I'm going to see red reflex and follow it into the eye. And then inspect inside. And with the left hand, my left eye. Again. All right. So I'm inspecting the optic nerve disc, vessels of the eye, and the coloration there. So next we're going to move to ear examination. Again, just visually inspect first for shape, position, symmetry, any skin abnormalities, crusts behind the ears. Then I'm going to do tag test. Does it hurt?
No.
Okay, and the opposite. Does it hurt?
No.
Okay. So usually if the patient has an infection, the inflammation would cause the pain if I pull. Now I'm going to look inside with the otoscope, using the largest attachment possible to fit the patient ear comfortably. I'm going to look inside. I'm going to pull up and backwards to open up the canal, inspecting for any discharge, visualizing bony parts, and tympanic membrane on both sides. Membrane should be pearly white or pearly gray, no bulging, no redness. The light reflection on the left side is at 5 o'clock and the right side is at 7 o'clock. Next, we're gonna check do some hearing testing. First, if you can close one ear and repeat the word I would say.
Apple.
Okay, and then close the opposite.
99.
Okay. All right, and this one is going to be the Weber conduction test. Which ear do you hear then?
Both.
Okay. And the next one is Rene test. Tell me when you stop hearing it.
Now.
Okay, and tell me when you stop hearing that.
Now.
Okay, good. And this is the test of hearing conduction. And obviously I would repeat it on the opposite side too. And this test check AC should be greater than BC. So air conduction is greater than bone conduction, and that's normal. Okay, then I'm going to use to inspect your nose. Again, visually inspect for any lesions, abnormalities, asymmetries. Tilt your head back a little bit. Just visualize septum, and then I'm going to use the lighting and look inside your nose. Just checking for any abnormal discharge, checking out the membranes, any septal deviations, and it's good. Next, we're going to move on to mouth examination. And visually, I'm going to inspect the lips. If there's any color changes, cracking of the lips, or maybe herpetic lesions or anything like that. Then I'm going to ask patients to open your mouth. We're going to use light. Inspect, lift up your tongue. Okay, now stick it out and say ah. Okay, also checking membranes, dentition, checking back at uvula and tonsils, checking the tongue, any abnormal exudate on the back, checking soft and hard palate, and any lesions inside the mouth. Okay, then we're gonna move to the neck examination. Again, I'm just visually checking. The neck is not twisted in any way. Can you lift up just a tiny little bit? The trachea looks midline. Okay, so next I'm going to palpate. I'm just palpating the trachea. It's midline, normal size. I'm going to palpate. I'm going to palpate for lymph nodes, and there's preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, occipital. Okay, tilt your head to the side. This is deep cervical. Does not always palpate because it's deep, but with the patient turning head to the side, sometimes it's possible to palpate. So these are deep cervical. And then supraclavicular and infraclavicular. Okay, then I'm going to palpate for actually coming from behind. I'm going to ask you to take a sip of water and don't swallow it yet. Okay, and I'm going to palpate from behind, find the just below the cricoid, and now swallow. And that lifts the isthmus up and makes it more easier to feel the thyroid. And palpating thyroid, let me know if anything hurts, okay? If anything is painful or tender. Palpating for any nodes, bumps, enlargement, or tenderness that would be reported by the patient. Do you have any questions for me today?
No.
Thank you very much. That concludes our examination. And thank you very much for letting me do the exam on you today.
Thank you.